Hello friends, the question is psoriasis in children. Actually 40 years ago when I was a student, it was written in the textbooks that psoriasis is a disease of third and fourth decade. That is, it occurs at the age of 30 and 40. So when psoriasis occurs at the age of 30 and 40, later ages, so then we find the complications are less. But nowadays it is written in the textbooks that the commonest age of occurrence of psoriasis is 18 to 25. So majority of the patients that we get is in 18 to 25 years of age. And recently I do find that a lot of children are also getting psoriasis from age 5 to 10 or even less. So psoriasis is increasing over the periods of 40 years. I know the age group has come down. So, and another important thing in psoriasis, earlier the age, more the complications. So if psoriasis begins around the age of 18, almost 10 to 12 years after that, when the child becomes almost about 30 years of age or 31 years of age, young man, he is likely to get the psoriatic arthritis. And it's a very debilitating disease, deformity of the joints and all these things. So the rest of his peak years of career are hampered. And nowadays, when you think that psoriasis in children has begun, by the time they become 25, they'll get. So the whole life is like that. So what is the reason and how we can avoid psoriasis in children and young people? Here I want to tell you that psoriasis is a genetic disease. One is born with this, but only genetics is not sufficient to cause the psoriasis, because if 100 people are having the genetic tendency of psoriasis, only 30 people get psoriasis, 70 people do not get psoriasis. So why these 30 people get it and why those 70 people do not get it? Because psoriasis needs certain trigger factors that are related to environment, that are related to your diet, that are related to emotional health and your psychology and your lifestyle. So these are the trigger factors, adverse trigger factors. For example, if stress, tension, insecurity, all these things, emotional setbacks, breakups, all these things, insult, stressful life, stressful job, all these things causes or precipitates. If you have a psoriasis, it will cause it. And nowadays we find it's more. On the other hand, it is not only this stress and all these things, but lack of sleep, lack of exercise, obesity, overuse of junk, processed, preserved foods, that also are the trigger factors of psoriasis. Smoking and alcohol is also trigger factor. And we think all these factors are common now in the age group of 18 to 25. That's why the psoriasis is triggered at that age. If you can control or avoid these trigger factors, only simply stress, insecurity, all these things are insufficient to cause full-fledged psoriasis, or they can be managed. But when all these things come together, so definitely psoriasis is triggered, and once it is triggered, once it takes place, so unless and until you treat it from the root, it will not go. Because according to allopathic science, it can only be controlled, it can never come back, it goes on increasing, and every time you get psoriasis, you need to take the medications to control it, but it is going to come back again and again. There is no cure for psoriasis in allopathic science, but in homeopathy, there is a treatment that can annihilate or that can remove the defect in the immunity and bring it back to its normal state, so that the patient's health is restored. He can live rest of his life without psoriasis if he undergoes the complete course of homeopathic treatment. So this is a possibility, and Psoriasis has been doing these things. So in children also we get psoriasis. So why do we get children psoriasis? So there are certain reasons. We have a lot of children having psoriasis, and we have noticed some of the recent changes in this children's life. Number one we find is that their diet, lack of exercise, lack of sleep, use of gadgets and all these things, late night sleeps and getting earlier, the burden of studies. Again, there is like a lot of I think parents are expecting so many things from the children, so they make their children to study a lot, to do so many things other than enjoying their childhood. So there is pressure from them also. And last but not least, recently we found the relationship in the parents. If the relationship is not proper, if they are having the conflicts in the parents, and the children, all they see, they feel feared, insecure when there is no proper atmosphere in life, in their family. That is family dynamics, we say that father and mother are having quarrels, having conflicts, fights. All those things we find causes insecurity in children, and that is one of the reason they are having stress. And although again that is a precipitating factor. So we find, I think I must warn over here that all these conflicts, although you think that children are small, but they are affected by your fights, by your conflicts, by the way you are not giving them proper attention on these things. So I'm really concerned and very serious about these things, that psoriasis in children, because if it is there earlier, the complication is more. And last but not least, the hopeful thing I will say, that homeopathy has very good results, almost good success in children, than we can expect a good results in children than in younger or older people, because their immunity also responds immediately to the medicines and very well. And if you treat properly the children at the younger age, definitely they can get freedom from psoriasis 10, 15, 20 years, and their psoriasis can be very well controlled, and they can live good healthy life until young age, or until they get very later old also. And if they follow the treatment, definitely it will be much better helpful. And moreover, these homeopathic medicines are without side effect, whereby if you continue allopathic medications for a long time, definitely there are proved side effects damaging the livers and kidneys. And again, there can be modern drugs which are even having more severe side effects. Although they have a results, temporarily they can control the psoriasis very well, but at long term, they hamper the body's immunity to an extent that you have to stop the disease, you have to stop the treatment and remain with the disease, and which is difficult to remain with the disease for a long time, and its side effects. So psoriasis in children is very common. You must take care, you must avoid the trigger factors, and you can go to the websites where we always make a lot of videos how to avoid psoriasis in children. So it is not only important that if your child is having psoriasis, but if you want your child not to have psoriasis, definitely you should go and see those videos to avoid it, because once the psoriasis begins, it is difficult and it will take a lot of time to control and cure it. Thank you.